Live from New York, I'm Lawrence O'Donnell, in for Keith Olbermann. On Capitol Hill, there are 6 registered healthcare lobbyists for every member of Congress, working on behalf of an industry that has spent $380 million in recent months to influence healthcare legislation. Our 5th story on the countdown, the Senate Finance Committee has completed its markup of a healthcare reform bill that would deliver millions of new paying customers subsidized by the federal government to the private insurance industry, with no public option. The Finance Committee finished its work at 2 a.m. this morning. A final vote on the measure has been delayed until next week so budget officials can certify the bill does not add to the deficit. In a statement, President Obama today said the committee's work represents a milestone, adding, quote, "We are now closer than ever before to finally passing reform." Under the bill, Medicaid would be expanded and the Children's Health Insurance Program would be phased out as kids on the program are transitioned to Medicaid and state exchanges offering subsidized private health insurance. Senator Jay Rockefeller, the chairman of the Health Subcommittee, sponsored an amendment to keep the Children's Health Insurance Program just as it is. With the committee working past midnight, Senator Rockefeller grew emotional as he recalled his first year in West Virginia as a Vista volunteer many decades ago, when he tried to help a young man named Eddie by getting him a job interview at Union Carbide. That job interview went awry when Eddie, who had never before been in a town with traffic lights, could not close the blinds in the office, Venetian blinds being something else Eddie had never seen before.
So then he sat down and we proceeded with the interview. But he couldn't give his name. He'd been stripped of all self-worth. What I'd done to him was substantially damaging to him. And a year later, he was gone from Evans, and I have no idea where he is today. But he had Medicaid. He had me by his side, and it didn't work. He had Medicaid by his side, and it did work. So I like to keep poor people where they have health care benefits. I don't wish to see them handed over to the tender mercies of a private exchange or whatever.
One Republican endorsement of the health reform bill today from former Senate Republican leader Bill Frist. Dr. Frist telling Time magazine that he would vote for the legislation if he were still in the Senate, but he didn't give a ringing endorsement. For one thing, Senator Frist predicts the bill as written will only extend coverage to another 20 million Americans or so, far short of the universal health care reform that would cover 45 million more Americans. For another, he believes it does not do enough to contain costs. Quoting him, "There is really nothing to bend the cost curve." The Senate Finance Committee made major changes to its health care bill in its final hours of debate, including an amendment narrowly passed that would allow states to provide coverage to individuals and families whose incomes fall just above the cutoff for Medicaid, but below the 200% federal poverty level. Joining us now is the author of that amendment, Democrat Maria Cantwell from the state of Washington. Good evening, Senator. Thank you very much for joining us tonight.
Good evening, Lawrence.
I know you had a long night last night, but could you tell us what exactly would your amendment do? It's not one that a lot of us had time to study before you introduced it.
Well, I want that ability to negotiate on behalf of the people of my state so that we can drive down the cost of insurance. As you were pointing out, the insurance costs have skyrocketed, and the insurance industry is here trying to protect that. And it's a question of whose side are we going to be on? Are we going to be on the side of the people and giving them more negotiating power, or are we going to let the status quo keep driving up insurance premiums?
Now, Senator, your plan is optional for all 50 states. Your state already has a plan like this. But if I'm the governor of one of the other 49 states, I would have some reluctance to start a plan like this because I'd be worried about whether it has a dedicated funding stream in the future. I mean, might this be subject to appropriations 2 or 3 years down the line after I start it up in my state, where the federal government comes along and says we're going to cut it by 50%?
I don't like the bill as it is now when we are subsidizing expensive insurance by giving tax credits to buy that insurance. It's not going to drive down the price. But instead, if we allow, and I'm more than happy to give this power to, all the federal government, but right now what we can do is push Republicans on the notion they like states' rights. Then the state can decide whether it wants to opt in and negotiate on behalf of its citizens. So I'd like Republican governors to tell me, no, they don't want to bargain and drive down insurance costs for their citizens.
Now, you got Chairman Baucus on this amendment, but you couldn't get Olympia Snowe, and you didn't get Blanche Lincoln on your side. What do you think it would take to move them closer to your position on this?
Well, I think the bill will come out of committee with this language on it, which means I think it'll have a very good chance to stay in the bill. And I think as Republicans find out more about it and hear from their individual states, they're going to realize that this is a choice between whether they're going to stand with the insurance industry or whether they're going to stand with the people of their state. And with premiums having gone up 120%, that means people are paying $7,000 more for insurance now than the same benefits they just had a few years ago. And so if we don't stop that continued increase, then we are just going to continue to put more U.S. families into bankruptcy. So this is about governors and about us standing up for the people of our country.
Now, most of the Democrats on the Finance Committee, including you, were able to hold off the Republican amendments attacking the tax provisions in the bill. When you get out on the Senate floor, where it's a much more freewheeling environment and the chairman doesn't have complete control as he does in that Finance Committee room, don't you expect a lot more argument over the tax provisions in the bill?
Well, you're going to hear a lot of things thrown at this, and basically people say, well, let's not do anything. But I think that we know if we do nothing, those insurance rates are going to double again in the next 10 years. And as Jay Rockefeller was saying, are we going to do something for people that gives them that safety net, that security? Because if you're making $40,000 a year or less and you can't afford insurance because of its exorbitant rates, are we going to continue this foolish policy of sending people to the emergency rooms for their health care? I don't think so. And that's what we have to fight to make sure that we get the message out that this is the kind of bargaining power that we need to give to the American people.
Senator, your committee voted for a tax, 35% or 40% tax on health insurance plans that are worth more than $8,000 for an individual or $21,000 for a family, these so-called Cadillac plans. Won't that tax automatically and virtually instantaneously drive up the premiums for those kinds of plans and or provoke dramatic cuts in benefits for people with those plans? And so the Obama promise of if you like your plan, you can keep it, starts to fall apart if that plan that I like and I want to keep falls apart in my hands, doesn't it?
Well, that's the vote we're going to have next Tuesday, and this is about continuing to move a process forward. But personally, I'd like to drive more money out of reforms. I want to control the cost of health care. I want to drive down the cost of premiums. If health insurance is raising about 8% a year and inflation's only 2%, that's where the issue is. We need to keep health care more in line with the rate of inflation. And so we ought to be talking about what we're going to do to drive down the cost of those premiums.
Senator Maria Cantwell of Washington, many thanks for your time tonight.
Thank you.